Do you have a newborn and you feel like they're always crying and you're having a hard time soothing them or wondering what you can do to soothe them? I really recommend learning how to swaddle, and today's video will show you all how to do this.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Welcome back to Be Kind Pediatrics. For those of you who are new to the show, my name is Dr. Blair Rolnick. I'm a board-certified pediatrician and mom myself. Today, we're going to really focus and take a deep dive into swaddling. I think swaddling is such an important topic for newborn parents because it can be really helpful in a myriad of ways. Firstly, it's very helpful for breastfeeding mothers to be able to calm their baby before they get to their breast. Secondly, it's a really great tool to have in your pocket for helping soothe your baby to sleep. And lastly, it's a really great form or tool to have for soothing your baby in general. So let's specifically talk about swaddling to sleep. I want to take a moment here and just pause and review the safe sleep guidelines. So safe sleep for your newborn means that your baby is alone, either in a bassinet or crib, that they have nothing in the crib, so they're on a firm mattress with a tight-fitted mattress sheet and nothing else in the crib. No bumpers, no pillows, no blankets, no hats on them, no socks or mittens on them, and no stuffed animals. That they are appropriately dressed. So overheating is a huge risk factor for SIDS. Generally, a good rule of thumb is that your baby can wear one more layer than you're comfortable in, and that they are lastly on their back. So you really want to make sure that your baby is always put on their back to sleep, never on their side or on their tummy. So the second question I always get from parents is swaddling safe? So there's really a very nice review article published in Pediatrics looking at that question specifically. And they found that swaddling is unsafe if your baby is sleeping on their side or on their belly. So you never want to put your swaddled baby down on their side or on their tummy. Again, you always want to put them on their back to sleep, nothing else in the crib. They can be in just a onesie or nothing, just their diaper and the swaddle, and that they're in a safe sleep environment like we just talked about. So when to swaddle? Swaddling is a great tool, especially in those first 2 weeks of life, but you can swaddle them until your baby is rolling. So once your baby starts to show signs of rolling, you should really be getting them out of the swaddle. Typically, babies can start rolling anywhere between 2 and 4 months, or that's typically closer to 4 months. So we just talked about when to swaddle, when not to swaddle. So swaddling really should just be used for soothing and for sleep. Swaddling should never be used in a car seat or in a baby that's put down in a DockATot. In general, I don't recommend DockATots, but really you want to limit swaddling to a safe environment, which is really going to be in a caregiver's hands or in a safe place to sleep, which again is either going to be in a bassinet or crib with nothing else in it. So now let's take a minute and talk about how to swaddle your baby. So I'm going to bring over this little baby for demonstration. And I want to start off with the Swaddle Me. So these, you can find these really anywhere. Generally, Target is a great place to get them. And the reason I like something like the Swaddle Me is because one really important part of swaddling is that you want to make sure that the hips of your baby are nice and loose and can move freely. And the reason for that is we really want to make sure that a baby is not papoosed straight down so that their hips cannot move. That is a risk factor for developmental hip dysplasia. So sometimes in the very beginning, especially if you have not used a lot of swaddles or you're new to swaddling, having a pre-structured swaddle can be a really helpful tool. And there's tons of these out there now. Halo, Swaddle Me, these are just a few brands. You are going to have your baby in a onesie or just a diaper. If you're using the Swaddle Me, you're going to put the swaddle, your baby in the bottom part of the swaddle. You really want to make sure that the swaddle is ending very clear of their mouth. So the swaddle should always go across the chest. It should never be near the mouth. Then you're going to take your baby's arm and you're going to gently put it under their hip. Some babies will fight you a little bit, and I use the word fight, but they're not really fighting you, but it'll be a little hard. Like you'll feel a little bit of, it'll be a little bit difficult to get their hand down. And that's just because most babies don't have totally relaxed tone. Just be patient and gentle, never force it, but just apply a little bit of gentle pressure and getting their arm down. And then, like I said, tuck it under the hip. So once you have their hand down, tuck this little piece around them and keep your hand there. And then you'll see on the Swaddle Me, there's a little matching piece to the Velcro here. You want to bring that across. And then you're going to use their other hand and get that down and keep your hand on there while you're doing this. Pull this across and tuck it under your baby around their back. So the tuck is a really important part of helping them their arms stay down and secure. And then you're going to see there's just two little Velcro pieces on this side, and you want to wrap it around and put it behind your baby. So when you're all done, what you should have is a baby who has no swaddle near their mouth, that you can easily put 2 fingers between the swaddle and their chest, that it's tight around their lower arms, below their elbows, but not the upper part of the chest, and that there's tons of room down here in the hip area for them to move their hips and legs. So I'm going to take him out of this, and then I'm going to show you how to use a cloth swaddle. So typically, I find these to be very cute, but not very practical for most parents, unless, again, they've been doing a lot of swaddling. But the cloth swaddle can be really nice on the go if you're using it to soothe, because you can just put the swaddle, under their stroller, or you can use it, fold up and put it pretty easily in your diaper bag. Some mommies like to use this as a nursing cover because the muslin cloth ones specifically are breathable. So to do this, open your swaddle. You're going to have 4 corners. They'll all be squares. Take one corner and fold it down. You want a pretty big triangle like that. Then what I recommend is that you put baby actually off a little bit to the left of the swaddle. Same thing, you want to get their left hand down gently and tuck it under their hip. And you're going to take 4 inches away the left side of the swaddle. And you're going to take it from their left shoulder to their right hip and tuck it. And tuck it behind them. So the behind tuck is the really important part. Then you're going to take their right hand and bring it down and tuck it under the right hip. Keep your hand there. Fold up the bottom of the swaddle. You can tuck that in to the top here. Get their hand under their hip, make sure you're holding it. And then you're going to bring this part, stretch it across and bring it up across their body, almost like a V-neck, down, and tuck this part behind them. And similarly, you'll see that this is the cloth then is away from your baby's mouth, that you can put 2 fingers under their chest, that you've got a nice good tight wrap around their lower arms, and that their hips are nice and free to move. Again, the cloth swaddle is a really nice swaddle to have for soothing. If your baby's upset, you can then kind of just get them in a sideline position, give them a nice little jiggle and a shh, shh, shh to finish off the soothing. Another really common question or concern I get from parents is, well, my baby really likes to have their hands in their mouth for self-soothing, or they like to have it up, or they really cry at the beginning of the swaddle. They seem super frustrated and upset when I'm putting the swaddle on them. All of these, I can reassure you, are really common for babies, But once they get into the swaddle, they do feel nice and calm and secure. And part of the thought process behind that is that when your baby is in utero, at the end of the 3rd trimester, they actually don't have a ton of room to move around. And so they feel nice and secure in the uterus. And so that this is kind of mimicking that security. Lastly, all healthy babies are born with something called a moral reflex, which when they are stimulated, so either by noise or sound or movement, their hands kind of go up like this and they get startled. And that startle can really wake them up or make them cry and difficult for them to soothe back down. So swaddling during sleep in those first couple of weeks can be really helpful in helping your baby be able to be calm through those moral reflexes. And 2, it can be a really comforting way to feel nice and snuggled and safe in when they're feeling like they need to be soothed. So I find this to be a really, really helpful technique for newborn parents to know. I hope that you found this video instructive. If you liked it, please go ahead and give us a like or a follow. If you have any questions or concerns, please leave them below.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.